It doesn't start with sirens. There's no loud alarm or dramatic collapse. For many people over 60, a stroke begins quietly, so quietly that the body whispers before it screams. A strange moment of confusion, a flicker in vision, a stumble that doesn't make sense. And then, just minutes later, everything changes. That's the reality of what experts now call pre-stroke warning signs. And if you know how to recognize them, you may have a rare chance to act before the damage is done. Most people believe strokes happen without warning, striking out of nowhere. And sometimes they do. But recent studies show that, in many cases, the body actually gives off early signals, small, subtle symptoms that appear minutes or even hours before a full-blown stroke. These aren't dramatic or obvious. They don't always cause pain. And that's what makes them so dangerous. They're easy to brush off as fatigue, stress, or aging. But they're not. They're the brain's final attempt to ask for help before it's too late. Ignoring these early signs can mean the difference between a full recovery and permanent loss of speech, memory, or movement. But noticing them, and acting fast, can literally stop a stroke from progressing. You don't need to be a doctor to spot them. You just need to know what to look for and what to do when they appear. In this video, we're going to walk through the 2 most common early warnings that often appear just minutes before a stroke hits. You'll learn what they feel like, why they happen, and how your response in those first few moments can protect not only your brain, but your independence, your mobility, and your life. Because after 60, it's not just about living longer, it's about protecting your ability to live well. To understand why early warning signs matter so much, you have to understand what a stroke actually does to the brain. A stroke isn't just a medical event, it's a shutdown. It happens when blood flow to a part of the brain is suddenly blocked or interrupted. Without that flow, oxygen stops reaching the brain cells in that area. And without oxygen, those cells begin to die fast. Every minute that passes means more damage, more loss, and less chance of recovery. The brain isn't like other parts of the body. It doesn't regenerate easily. It doesn't have backup systems for many of its functions. If the area that controls speech is affected, the ability to talk or understand language can vanish. If the stroke hits the motor regions, one side of the body may stop moving. If it impacts memory or reasoning, independence can disappear. And what's worse, the person having the stroke may not even realize it's happening. This is why timing is absolutely everything. The sooner a stroke is recognized and treated, the more brain can be saved. In medical terms, there's a narrow window, typically about 3 to 4.5 hours, where clot-busting medications can make a real difference. But every 10 minutes of delay reduces the chances of full recovery. That's why experts say, time is brain. And it's not a slogan, it's biology. Recognizing the signs in those first few minutes, before the stroke fully develops, isn't just helpful, it can be life-changing. Especially for people over 60, where risk factors like high blood pressure, diabetes, and circulation issues are more common, the ability to act early is one of the most powerful tools we have. When you know what's happening inside the brain during a stroke, you realize something simple but urgent. The clock isn't just ticking, it's taking. And every second you wait is a second the brain can't get back. One of the most overlooked warning signs of a stroke is not physical, it's mental. Sudden confusion, disorientation, or what some describe as a mental fog can be the brain's very first signal that something is wrong. And because it doesn't come with pain or visible distress, it's often dismissed as tiredness, dehydration, or simply a bad day. But in people over 60, especially those with underlying health conditions, this mental shift may be a critical red flag that the brain is losing oxygen. This kind of confusion can show up in subtle ways. A person might suddenly forget where they are, forget familiar names, or have trouble following a simple conversation. They may ask the same question twice in a row or give strange answers to basic prompts. In some cases, they may struggle to understand what others are saying, even if they can still speak clearly themselves. This isn't normal aging. It's a possible sign that parts of the brain responsible for processing and memory are being affected in real time. What makes the symptom so dangerous is that it often comes and goes quickly. It may last for just a few minutes before the person seems back to normal. That brief improvement can give a false sense of safety. But in many cases, it's only the beginning. It may be what neurologists call a TIA, or mini-stroke, which often precedes a full stroke within hours or days. Recognizing it for what it is, an urgent signal, not a momentary lapse, can buy you precious time to get help and prevent further damage. Family members and caregivers play a vital role here. You're often the first to notice when someone's behavior doesn't match their usual self. Trust that instinct. If your parent, partner, or friend suddenly seems confused, even briefly, don't wait to see if it passes. Time is critical, and early action could stop a small warning from becoming a life-altering event. Because when the brain starts to falter, even in small ways, it's not just a moment, it's a message. And knowing how to read that message can protect everything that matters most. The brain controls everything, from how you see the world to how you move through it. So when blood flow is disrupted, even for a moment, one of the first places it can show up is in your vision or your sense of balance. If you, or someone close to you, suddenly has difficulty seeing clearly or feels dizzy or unsteady without warning, it may not just be fatigue or inner ear trouble. It could be the second early warning sign that a stroke is moments away. Vision changes can include blurred sight, double vision, or partial vision loss in one or both eyes. Some people describe it as a curtain dropping over their field of vision, while others say it feels like they're looking through water. These visual disruptions often appear without pain or explanation, making them easy to ignore. But in the context of stroke risk, they should never be brushed aside. Equally alarming is sudden loss of balance or coordination. A person may feel like the room is spinning, have trouble standing upright, or stumble for no clear reason. In some cases, they might reach for support when they normally wouldn't need it. These episodes can be mistaken for low blood sugar, dehydration, or simply getting older, but they may actually be the brain's way of signaling that certain regions, like the cerebellum or brainstem, aren't getting the oxygen they need. What's critical to understand is that these symptoms don't have to be dramatic to be dangerous. A slight misstep, a sudden sway, a moment where the world seems out of focus, these can all be part of the body's final alert before a major stroke hits. And just like with confusion or mental fog, the episode may pass quickly, creating a false sense of calm. That's why awareness is key. If someone suddenly says they can't see clearly, feels dizzy for no reason, or can't stay balanced while walking, even if it lasts just a few minutes, treat it as a medical emergency. Don't wait to see if it goes away. Because in those moments, the brain may be fighting for function, and time is its only ally. Despite their seriousness, sudden confusion and vision or balance problems are often dismissed. Not because they're subtle, but because we've been taught to underestimate them. In people over 60, these symptoms are frequently written off as just getting older, a bad night's sleep, low blood sugar, or stress. They come on quietly, often without pain, and sometimes disappear just as fast. But what looks harmless in the moment can become irreversible in the next. Part of the reason these signs go ignored is familiarity. Many older adults experience moments of forgetfulness or feel a bit off balance from time to time. That makes it harder to spot when something is truly different. There's also a natural tendency to wait things out, especially when symptoms are brief. People may not want to seem alarmist, or they may fear wasting time in the emergency room. But this hesitation, while understandable, comes at a high cost. The cost is time. The few minutes you spend deciding whether it's serious enough to call for help could be the same minutes the brain is being deprived of oxygen. Once those cells die, they don't come back. And the difference between a stroke that leaves you with minor symptoms and one that takes your independence can be just a handful of minutes. There's also the emotional cost. Families who witness these early signs but dismiss them often carry guilt after the fact. They remember the moment their loved one seemed confused or had trouble walking and wish they'd acted sooner. But this isn't about blame. It's about breaking a pattern. It's about learning to trust those early warnings and take them seriously the first time they appear. By changing the mindset from wait and see to act and protect, we can give people over 60 a real chance to avoid the worst outcomes of stroke. And we can replace hesitation with clarity, fear with preparation, and regret with relief. When a stroke begins, every second counts. The brain is losing oxygen, and with each passing minute, more cells are at risk. That's why your response in the first 5 minutes can shape everything that comes after. You don't need to be a medical professional to make a life-saving difference. You just need to act with clarity and speed. The first and most important step is to call emergency services immediately. Not a neighbor, not a family member, 911, or your local emergency number. Tell the operator that you suspect a stroke and describe the symptoms clearly: confusion, vision changes, loss of balance, or anything else unusual. This helps dispatchers prioritize your call and alert paramedics to prepare for a potential stroke patient. Next, note the exact time when the symptoms started or when the person was last seen well. This is critical. Treatments like clot-busting medication must be given within a narrow window, typically 3 to 4.5 hours. The emergency team will ask for this information, and it could determine whether certain treatments can be used. While waiting for help, keep the person calm and still. Have them sit or lie down in a comfortable position, ideally with their heads slightly elevated. Don't give them food, water, or medication unless instructed. If they become unconscious or stop breathing, be prepared to perform CPR if you're trained. But in most cases, just being present, focused, and reassuring makes a huge difference. Resist the urge to downplay symptoms or talk the person out of getting care. Stroke symptoms can fluctuate. They might feel better for a few minutes and say they're fine. Don't wait for the signs to return. If you saw them once, they matter. And acting on them could preserve the person's ability to walk, speak, remember, and live independently. These 5 minutes won't feel heroic. They'll feel tense, uncertain, and fast. But in the quiet of a hospital room hours later, when doctors say you caught it just in time, you'll know exactly how much power there was in those first few moments. For decades, the medical community believed that strokes came without warning. But recent research has shifted that view. Today, neurologists and stroke specialists agree that the brain often sends out early signals, sometimes hours, sometimes minutes, before a full-blown stroke occurs. These are called pre-stroke or prodromal symptoms, and understanding them has become a new focus in stroke prevention, especially for adults over 60. Studies have shown that up to 1 in 3 stroke patients experience subtle warning signs beforehand, often dismissed or misunderstood at the time. Confusion, balance issues, and sudden vision problems are among the most commonly reported early symptoms. These signs don't always mean a stroke is inevitable, but they should always prompt urgent medical evaluation. According to the American Stroke Association, even a temporary symptom could be a transient ischemic attack, TIA, a short-term blockage that serves as a major red flag for a larger stroke within days. Medical experts emphasize that early detection is not just helpful, it's transformative. A stroke caught early can be treated more effectively. Clots can be dissolved, damage can be reduced, and recovery can be faster and more complete. But this is only possible when patients and caregivers take action at the very first sign, not after the damage has already taken hold. The challenge, according to experts, isn't just medical, it's cultural. Too many people believe that only dramatic, visible symptoms count. But a slight loss of balance or a moment of confusion can be just as serious as facial drooping or arm weakness. By the time the more classic signs appear, precious time may already be lost. That's why stroke specialists continue to educate the public about these earlier clues. They're not meant to scare you, they're meant to empower you. Because when you understand what your body is trying to say, you give yourself the chance to protect your mind, your memory, and your life with one crucial response: immediate action. Knowing the warning signs of a stroke isn't about living in fear, it's about living with power. After 60, it's natural to become more aware of your body, your limits, and your health risks. But awareness doesn't have to lead to worry. It can lead to confidence, calm, and smarter choices that protect not only your brain, but your independence, your voice, and your daily life. Preparedness means recognizing that symptoms like sudden confusion or balance trouble aren't random. They're messages. When you understand what they mean, you can act faster, speak clearly to emergency responders, and ensure that precious time is not lost. That kind of readiness turns uncertainty into direction. It transforms what could be panic into purposeful action. Living prepared also means sharing this knowledge with your partner, your children, your caregivers. Make sure others know what to look for and what to do. Because in a real emergency, it's often not the person having the stroke who calls for help. It's the one standing beside them. When your circle is educated, your safety grows far beyond yourself. Most importantly, Being prepared allows you to keep your focus where it belongs, not on fear, but on living. On enjoying your routines, your relationships, your passions, without the quiet weight of what if. Because when you know how to respond, you don't need to be afraid of the signs. You simply respect them, act on them, and move forward with clarity. The goal isn't to avoid every risk. It's to be ready, mentally and practically, so that when your body speaks, you're one step ahead. And that readiness doesn't just protect the brain. It protects the life you've built around it.